first quality improvement tool that I'm going to go over is the fishbone diagram, which breaks down multiple categories and possible subcategories that could explain the possible cause for Mr. Jones's CAUTI. So the first category would be the people, in which case would be the nurse, and it would be an untrained nurse if she didn't know the proper technique for sterile insertion, no proper hand hygiene prior to insertion, ordering the Foley without indication, which we don't know necessarily if it is in this case. That goes hand in hand with not removing the Foley on time. He does have the Foley, Mr. Jones did have the Foley in for quite a few weeks, so the nurse could have followed up to see if maybe he even needed the Foley reinserted. And hesitancy in questioning orders, which again might not necessarily apply to this situation, but it's similar to questioning if does Mr. Jones really need this Foley still? Maybe we should start testing if Mr. Jones can start producing his own urine on his own. But the most probable explanation is going to be poor hand hygiene and an untrained nurse, or just maybe a careless nurse who didn't follow proper technique. The second would be an issue with the material, so the Foley itself, whether that's a faulty catheter, kinked tubing, and clogged tubing. So in this case, the Foley did become clogged, which can cause the bacteria to accumulate and colonize, and that could have been caused by possibly some kind of issue with the catheter itself, or kinking, or it might have just been an issue of the nurse not checking it frequently enough. The next would be an issue of procedure. So that could be prolonged catheter use, irregular emptying of the Foley bag, or unsecure catheter. This just has to do more with the procedures of managing the Foley itself, which, possibly prolonged catheter use could apply to Mr. Jones, but it's probably more likely due to the latter reasons that we mentioned. The next would be environmental factors. So considering that Mr. Jones is in a home health setting, this decreases the likelihood of it being a hospital-acquired infection, which is good, but nonetheless, you could still get a CAUTI regardless without being in the hospital. So these, the environmental factors more apply to a hospital setting, but still, limited bladder scanner. You're not going to have a bladder scanner in the home most probably, so they won't be able to check urine retention, quality of nurse training, and high proportion of isolation patients. Of course, you're not going to have high numbers of isolation patients in the home, so that kind of hospital-acquired infection transmission won't be super relevant to this case study. And then the last would be policies. So policies also play a huge factor. They can be regarding lack of education, regarding HAIs and CAUTIs, lack of enforcing policies, and lack of systematic policies. So that could allow for nurses to not perform to the highest standards, or because they don't know exactly what these standards are. So clear policies and the enforcement of clear policies are really important to be enforced to ensure high quality nursing care.